Assalamu alaikum. Welcome back to neurological assessment. In today's video we are going to taking you through the lower limb neural tension test as a part of lumbar spine neurological assessment. The aim of these tests, as discussed earlier, is to test whether or not we can reproduce patient symptoms of paresthesia or shooting pain in lower limb to see if these structures are under stress or tension. For each test, go through a process of progressively sensitizing the nerve being tested until the potential point where the patient's symptoms of paresthesia or shooting pain in lower limb have been reproduced. If we able to reproduce the symptoms, then we know that the nerve we are testing is under neural tension or is irritated. With that in mind, let us start our video. Today's video is about the lower limb tension test. The first test we are going to perform is the straight leg raise. In the SLR, we are going to stress the lumbar plexus or sacral plexus, as in the upper limb we stress the brachial plexus. For SLR, the therapist raised the patient's leg to 50 to 55 degree or to the point where the patient feel numbness, tingling, paresthesia or pain. As we continuously ask from the patient is to feel any pain, numbness, etc. Then for further examination, we can add the more positions of foot, like the dorsiflexion of foot. Please, as a therapist can do the dorsiflexion of the foot to stress the neural structures in the leg. The further positions we can add to stress the neurological structure in the leg is the adduction of the leg. Please, as a therapist, do the adduction of the leg and then do the medial rotation of the leg. And continuously ask from the patient is to feel any paresthesia, numbness or pain. The further test we can add up for neurological examination of lower limb is to ask the patient to please flex your neck with the raised leg. For the test we can add up we can remember the test by the acronyms SIT, PIP and TIT. SIT mean we are going to examine the sural nerve. S means sural nerve. ID mean inversion and dorsiflexion. The therapist raises the leg of the patient and then invert the foot and then dorsiflex the foot. In this way we are going to stress the sural nerve. The next we are going to examine the peroneal nerve. For this test we are going to invert the foot, inversion of foot and then plantarflexion of foot. Please, as a therapist, do the inversion of foot with the raised leg and then the plantarflexion of the foot. In this way we are going to examine the peroneal nerve. In the third step, we can check the tibial nerve by the eversion and dorsiflexion of the patient's foot. First, the therapist raise the leg of patient to 50 to 55 degree and then eversion of foot outside the foot and then dorsiflexion of foot. In this way, we are going to examine the tibial nerve. Thank you.